Assalamu alaikum, the communication day. First scenario, you are the doctor in the general medicine clinic. Your patient is Miss Kanfi, 62 years old, housewife who was investigated for low back pain for 3 months duration. The investigation have confirmed that she has myeloma with raised beta-2 microglobulin, serum creatinine, and serum calcium. Your task is to inform her about the diagnosis, answer any question, and arrange for further management. Do not examine the patient or take history. Ready?
Yes, ready.
Okay, here you go.
Hello, I'm,
Hi.
I'm Dr. Hosni, one of the senior registrars today. May I confirm your name and age?
Okay, I'm Mrs. Kansi Gwanaradin. I'm 62 years old.
You are welcome, Master Kansi. May I ask you, what do you know about your condition so far?
Yes, doctor, I've been having this pain in my lower back for the past 3 months now, and I've been going from hospital to hospital, and they seem not to know what is wrong with me. And I came here to your hospital some weeks ago, and they did some take my history, and then I did some blood tests just and came to know about the outcome, doctor.
Mr. Kansi, do you want anybody to attend with you?
No, I'm okay. I'm okay, doctor.
Mr. Kansi, what do you expect from me today?
Doctor, I want to really know what is wrong with me, doctor.
Mr. Kansi, the imaging studies and blood test has came and it was not as we hope.
Doctor, I don't understand.
Sorry to say that, because this your blood test and imaging has came and it reveals that you have what we call multiple myeloma. Do you have any idea about this?
Doctor, that sounds big. I don't know. I don't know what it is.
It is
Is this so many sickness? Is it multiple? Is it so many sickness?
it is some type of cancer on the blood cells known as plasma cells. It secretes some proteins called antibodies. Also, it can make destruction of the bone and increasing the blood minerals, salts known as calcium.
Oh my God. Oh my God. Oh
Sorry to say this.
oh my God. Oh my God. Doctor, you mean I have cancer?
Sorry to say this. It is some sort of cancer. I'm very sad to inform you about this.
So oh God, why me? Why me?
We will support you.
Why me?
We will support.
Why me?
We will support you. Do you need any tissue, any water?
Oh, I'm okay.
Support you.
I'm okay, doctor.
We will not leave
I'm
you
okay.
alone. We are here to help you as possible as we can.
Oh, God. Doctor, does that mean I'm going to die soon?
With the treatment, you will be improved, and we will help you to relieve pain and supporting you by some our multiple disciplinary teams. We will give you. We will help you to live in a peaceful way. So don't worry. We are help you as possible as we can.
So, doctor, what am I supposed to do now?
We will involve our multiple disciplinary team and cancer doctor and social and occupational doctors, and we will support you and give you some treatment by cancer doctor to control the cancer.
This is hard. It's really hard.
I'm sorry to say this for you.
So, doctor, is it because of my faults that this thing
No,
happened to me?
no, not at all. It is may occur to anybody because of because of aging process. So it's not your fault at all.
So, doctor, will my children suffer for the same consequence, the same condition?
Sorry?
Will my children have suffer for the same problem also?
We will help you by making proper treatment. And let me ask you, do you want any support at home?
Doctor, I really need support at home, doctor.
So we'll arrange support for you. Don't worry. I ask you, what is the effect of this problem in your life?
Doctor, I'm a housewife, and my husband is not currently staying with me. My husband lives in Pakistan, and I live in India. I have 3 children that is here with me. The other ones are grown up. They are the 2 of them are grown up with their family, but I have one that is homeless, and he's not doing anything. He's having a long standing. He's crippled, kind of, and I do take care of him alone.
Sorry to hear this, but we will support you. We will support you socially and financially, and also we will involve occupational therapy and occupational health section. We will help you to pass this problem easily.
Yes.
Miss Counsel, do you drink alcohol or smoking cigarettes?
No, I don't. I don't drink alcohol. I don't take cigarette because of my health condition.
Good. Also, I would like to give you brochure and leaflet about this condition. Know more about it, and we will help you, and we give you our phone number to contact us if you need any help or you want to ask any question.
Okay, doctor. Doctor, with the treatment that you spoke about, is it going to be very painful?
We will give you pain relief, so you will not feel pain. So don't be afraid.
Is it a surgery, or I don't know what are my treatment options, doctor? What's
No, it is not surgery. It is just by medication which given through the venous channels.
okay?
Do you have any concern?
Yes, doctor. I do have some other concern, doctor.
2 minutes left.
So,
Doctor, how long do we have to live with this cancer?
I'm not sure about how we need to live. I will discuss this issue with my senior, and will come back to you soon.
Okay, doctor. Okay, doctor. It's okay. It's all right.
I'm so sorry to inform you with this information, but we are supporting you, and you are not alone. We will help you as possible as we can by our multiple disciplinary team, including cancer doctor and social and occupational health workers.
Okay, thank you, doctor.
Thank you.
1 minute left, Dr. Hasni. You want to ask anything else or to offer? By the way, you did great. So far, you do good.
Really? I
Yeah,
can't,
really. Yes.
I can't believe.
You cannot believe, yeah. No, no,
I,
you did great, really. As a first time, if you finish, we can comment. If you
okay.
don't have any question or concern, you can raise. What do you think? There is a concern. Does my kid have this disease? You didn't answer it. Okay, answer this concern, then we can finish this station.
What was the question?
Yeah, will my kid have this cancer in the future?
No, this is not a familial condition. It is not running in the families.
Okay, it's not in your family, but there is any possibility this family kids might have this blood disease in the future?
I'm not sure really about this. I will discuss
Okay,
with.
good, good. We will discuss it. Okay, we will know how to answer it. In
Yeah, yeah.
general, you did really good. Dr. Hina, you can comment now.
And thank you very much, for you did very well. Like what my Oga said, like what Dr. Bazim said, you did very well. It being your first time also, like he said, it was good. Your confidence was okay. You followed the pattern of the spike. You did the setting, which was good. You checked my perception. You gave me the information. You gave the warning shots. You know, which was also good. You you showed empathy. When I was crying, you assured me, you gave me time to pour, and then you went ahead to address my concern basically. By and large, it was a good one. It was a good one, I must confess. It was a good one. I think basically the other thing I wanted to say is that in the scenario, there are values that tells to point towards the severity of the multiple myeloma. There are certain things that you have to put into cognizance, certain details. Like if you look at the scenario, there's a part that they put in terms of the value of beta 2 microglobulin, and serum calcium, and they are always knowing fully that the kidneys is affected, and tells you that there's in this case, it has a very poor prognosis. The markers of severity in multiple myeloma, this particular patient. So we need to also address that, knowing fully that he has multiple myeloma. In our own case, he has an active one, and she will require immediate intervention. Like in this patient, you may need to talk about a referral to the hemato-oncology, because it's not every question you can answer, being that you are a medical registrar, like in the case, said you are registrar in a general medicine clinic. So you're not the one that will manage our own case. You talk about referring her to the appropriate body or the appropriate specialist, which involve, like although you mentioned that in the tail end when you talk about the MDT, which is good, but you need to let her know that you need to refer her to see the other people that will manage her, which is the hemato-oncologist, the Macmillan nurse, other, and mention some of those the the doctors that and the health, like you mentioned, which is good. They're also being in charge of our own case. And basically, like you said, you are just a concern very well. When she asked about the kids you gave, truly, it is not something that it is not a familiar thing that the children we inherit or we suffer from the same fate. It's a cancer. It's a cancer of the. But I also noticed that you use some jargons during the course of your what do you call it, your communication, although you intermingle there with the main words. But I noticed that we are too much plasma cell, a lot of things you are saying. You also explain them, or not. You did not really explain all of them, but if you can limit those bigger words, like when you say the patient has multiple myeloma, which is what the patient had definitely, which is a cancer of the blood, which is what you said, and which is a good way to say it. I think by and large, let me leave the floor to Dr. Bazim. I think it's a good one. Thank you.
Thank you.
Yeah, thank you, Dr. Hinari. Dr. Hasni, if you can find any scenario, communication scenario, and send it to me, or you can send it to the chat box while I'm commenting on your performance. Okay. As I said, you did perfect as a first time, really. Yes, it looks like you are hesitant, but you did it in good way. Basically, you cover the all basic information you have to do in any communication scenario. For example, the introduction, you introduce yourself, but don't say I am senior registrar. Okay, say I am one of the doctors here, because it's not mentioned here that you are senior registrar. Regardless the position, mention I am one of the doctors here. Finish. Are you Mr. or Mrs. X? You are 30 years or 65 years? Yes, I'm here to discuss about your health condition. Do you want anyone to attend this meeting? I agree to invite someone because it's a topic very sensitive, and it's bad news. It's breaking bad news, definitely, because it's a cancer. Okay, so you can invite someone to support here. If she said no, it's okay. You can start and the discussion by saying, "How are you? How do you feel?" "I'm fine, doctor." "Okay, let me know about what do you know about your condition so far." She will tell you, as she said, or Dr. Hinari did. The expectation, what do you expect from the result? I have the result. What do you expect about the result today? I don't know, doctor. It might be infection, whatever he will mention or she will mention. Then you can stop and give her the warning shots. Actually, the results are with me now, and it's not good as we hope, as you did exactly. Then stop. This is the golden silence. So the warning shot, then golden silence, then wait for her to react. Doctor, tell me, what is it? Is it something worried? Unfortunately, sadly, it showed that you have a cancer. Oh my God. She will react, she will cry, whatever she will do, then offer her, as you did, tissue, water, are you okay? Don't say if you want to postpone the meeting. Okay, it's not accepted, because if the surrogate tell you yes, we can't postpone, you will be in trouble. What if she said yes? So don't offer. Some doctors, they are telling, if you are not feeling well, we can postpone this meeting. Till what? What do you think they postpone? Is it accepted? No. The doctor, the surrogate maybe say yes, and you will already terminate your station. So don't say. So how are you now? Are you okay? We can continue. Yes, doctor, please carry on. I want to know more about this cancer. Yes, it's one of the cancer that involve the blood cells. I'm so sorry to say that, and be sure that we are supporting you as you did exactly. We will be with you along all this journey. Don't worry, we'll do our best to let you feel comfortable as much as we can, and to have good quality of life. In the best of interest, we refer you to group of doctors: blood doctor, cancer doctor, kidney doctor, and physiotherapy. Or but don't mention occupational therapy. Don't say team you don't know. You mention occupational therapist, which is not here in this scenario, or occupational team, right? What they will do? She's housewife. Occupational team for those who are jobless, okay? Either to reallocate or to find a job for them. But she's housewife. What they can do, or what you can offer here? And don't offer financial support. They have their own support as financial, but the most important here, the medicine, the social, the emotional support. No need to mention financial support. Okay, back to the about any disease, you have to mention and to talk about the pathophysiology. What is the pathophysiology of multiple myeloma? A cancer of blood, as you said, and I said, and it causes low blood count, right? And it's unknown. No one know why this happened, right? It's unknown. Let's talk about the clinical manifestation. So the patient will have, this is as a clinical judgment. You didn't mention the CRAP, hypercalcemia. You mentioned the calcium, increased calcium. So you might have some of the increased water work. You might have increased feeling thirsty. What else? Patient might have renal failure. So you might have suffer decreased water work, and you might have other complication of stop the function of the kidney. This is R, crab. The next will be anemia. You might feel dizzy, understanding. You might feel difficult to or short of breath with exertion or with exercise. And the last thing is the bone. back pain, which you already mentioned in the scenario, and you might have also back pain, the thing you are suffering from already. Doctor, so what you will do for me now? Unfortunately, we will admit you. We'll refer you to some group of doctors. The cancer, the blood, as I said. What you will give to me, doctor? We might give you some medicine to kill this cancer cell. We call it in our medicine chemotherapy, right? Multiple myeloma is treated by chemotherapy. So, cancer doctor will prescribe you for you some medication called chemotherapy. You might be admitted to receive this medicine because it's highly or high dosage or concentrated medication. You should receive this medication in the hospital. And during our follow up, during this journey, we will have multiple follow up with you. We will do some imaging, we will do some blood tests to confirm the progress of the disease or the response to the chemotherapy. Okay, simply try to be as simple as you can. The complication, you can mention the destruction of the bone, backbone, backbone because of the uh, destruction. You might have fracture of the backbone because of the destruction of the bone. You might have kidney injury. You might have a stop of the function of the kidney, and you might have dialysis, which is renal replacement therapy. I don't want to give more details, but at least to know more about this information. Why? Because you have some time at the end. You have 2 minutes, so you can speak about the clinical manifestation and complication. Any disease, you have to speak about these things: the pathophysiology, the manifestation, clinical manifestation, and the complication. Okay. Back to the team already mentioned, the chemotherapy mentioned, and the management plan. Yes, you have to talk about the management plan at the end. We already mentioned. Then the support. Do you have any kind of support, or do you need any kind of support? We are here. Be sure that we will provide you any kind of support that you need. What's your job? I am housewife. How the impact of this back pain on your job or in your daily activity? Particularly the back pain. Why but back pain? Because they mention it in the scenario. Patient is having back pain. And this is the first presentation of the patient because of the back pain. So you can ask about the back pain in particular. How is the impact of this back pain on your daily activity? Yes, doctor, I feel very difficult to cope with. Okay, don't worry about that. We will provide you with painkiller prescribed by our pain doctors. Okay, anything else? Any concern? Doctor, does it run in family? It's not the type to run in family. However, your kids, your kids are having more possibility than other population. Why? Because as you know, the families with cancers sometimes and usually they are more prone to cancer than other families, but not as a genetic, right? That's it. Then anything you need. Do you smoke? Do you drink alcohol? If she smoke, you have to ask her to recommend strongly. They recommend stop smoking, the alcohol as well. And thank her. You can provide her leaflet brochure about multiple myeloma, how to be managed, any complication might happen, and red flags at the end. If you feel dizzy, if you feel short of breath, please let us know. If your water work being less or no, you have to call us. Clear, Dr. Hosni?
Thanks,
And
Baba.
just to add, Dr. Bazin, also,
Yes.
he also mentioned when he mentioned something that was not part of the scenario. He mentioned imaging. He said because he mentioned imaging in the scenario, there was nothing like imaging there. So be careful so you not say something that is not written in the booklet. He
Okay.
mentioned investigations. They didn't say imaging. You now said
Okay. Yeah, yeah.
you mentioned imaging. What they said was
No, no.
investigation.
I said
Uh,
for the follow up imaging for the
no,
follow up.
no, no, not you to Basim. It's for him. What he said, because when he was communicating with me, he said not he was telling me that
Yes, I
he
agree. I
has
agree,
seen
Dr. Hene. I didn't
uh,
change my words. I'm saying in the follow up, it's not written there, But any patient with back pain, they have osteolytic lesion in the back, they might do
Mm.
MRI for them
No, yeah, no,
as a
no, but
follow-up.
no, no, that was not what he said. What he said was that after when he asked me about my perception, when I told him about my perception, he now said, okay, that yeah, that they have done some imaging for me, and they find out that I have what they call multiple myeloma. That's what he said. That was what he said
I said
when he was.
the result are with me. I didn't say the image. The result are with me. It showed that you have multiple myeloma. I didn't say the imaging.
No, not you, Dr. Bazim. It's the candidate,
Ah,
not
okay,
you.
Dr. Hosni. Okay,
Yes,
okay,
Yes,
okay,
not you. No,
okay. Yeah,
me,
yeah,
it's not you.
yes, it's correct. I mentioned imaging.
yeah, yeah. Don't say
Not
something which is the okay. I thought you are talking about me,
no,
Dr.
not
Henry.
you. No, no,
Yeah,
no. I'm
okay.
talking to him
So
himself.
yeah, yeah.
Sorry.
He's
Uh,
saying, Dr. Hasni, don't say something not written in the scenario. Don't say
yes.
the imaging with me. What written you have to
Okay, got
mention.
it.
So the result
Mm,
with me means the result with me. Maybe she will, if you say the imaging with me, she will tell you, doctor, I didn't do imaging. So it's you will look like saying something wrong. Okay.
yeah.
Okay.
What's written,
And
you have
also,
to mention. Yeah.
okay.
Okay.
And also, even if imaging was done, the word imaging, I don't think is it. I don't know. Dr. Bazim, is it a jargon?
Yeah, yeah. Imaging is not jargon. You can use
Okay.
it for the follow up.
Okay.
They are
Okay.
doing
Thank you.
follow up for the osteolytic lesion,
Okay.
right?
All
So you
right.
can do it, or
Okay, sir.
fracture. Sometimes this osteolytic lesion might lead to fracture. So you have to mention the imaging as follow up.
Okay. Okay.
Okay.
All right. Thank you.
Yeah, MDT as a jargon. Yes, when doctor
Mm,
mentioned MDT, I said group of doctors. So we will refer you to group of doctors, or you can say multiple or multidisciplinary team. Then explain what is the multidisciplinary team. So you can say multidisciplinary team, which is a group of doctors. They will follow you and they will give you the best interest of your condition. Okay. Any other thing you want to add, Dr. Henry?
I think by and large, I think
Okay.
that is that is no, thank you.
Okay, perfect.
Thank
Dr.
you,
Husni?
Dr.
And
Bassem.
then sorry, I want to add something to Bazin. Sorry, I wanted to add
Yeah.
something. When he said that if I smoke or drink, I
Yeah.
said I don't smoke, I don't drink because of my health condition.
Uh-huh.
But he kind of neglected that important word I said.
Yeah, yeah,
You
yeah.
should have asked
So
me, okay, which health condition are you talking about? Or probably, can you tell me more about your health condition? Because this person might have a background, other condition that may not listed there. That was why because he said that the patient responded that I do not smoke, I don't smoke, I don't drink because of my health
yeah,
condition.
yeah.
You should have probably, since you still have time, like what no more, you know, you know, tend to know the which of the health condition is talking about. If you have something that is not part of the
Yes, yes.
scenario, probably that also guides your
Not only that, Dr. Inari,
yeah.
not only that, you have even to appreciate
Mm,
being he's not smoker or not drinking
yeah.
alcohol. It's a very important thing whenever you have patient saying to you, doctor, I quit smoking or I cut down the alcohol. You have to appreciate that. You have to say to him, it's a good step in your life because always the smoking are harmful and the alcohol are harmful to your health generally or specifically according to the function of the kidney or the liver, whatever the patient is having. What I want to say, appreciate the good thing the patient is doing. They are respecting this issue. Okay.
Okay, thank you.
Okay,
Okay.
thank you, Dr. Bassem. Thank you, Dr. Henry.
Most
Uh,
welcome, Dr. Husni.
Actually, I was stressed as if I in a real exam, and I was my brain was blank. So I do some mistakes like imaging when I start to explain.
No, no, no. Forget about it. It's first time. Don't focus in this time. Okay. Don't comment on this practice. You have to practice more and to comment on yourself after many practice. What you did as a first time, it's very really good. You did the old scheme of communication as a first practice. You didn't miss the introduction, the breaking bad news, the concern. Even you answer it in good way. Even when he asked you for how long, doctor, or will I die, you told him I can refer or I can ask my senior. They can answer this question. It's a good answer, not wrong answer, but I will tell you how to answer this. Any cancer known as or it used to shorten the life of the patient. So this is the answer, Dr. Hosni. The
Yes, what?
cancer, yeah, the cancer or any cancer, it used to shorten the life of this patient.
That's
Okay?
logic.
Yeah.
Yes.
So I'm so sorry to say it can shorten your life compared to previously or to others. Clear?
Okay, good. The other thing also, I was reacting as if it's a real life, so I didn't like to mention too many complication and explanation for myeloma regarding the kidney, bones, and hypercalcemia, so not to increase the emotion and frustration of the patient.
Yeah.
No, it's a clinical manifestation. You have to talk about even briefly in one sentence or maximum 1 minute. The presentation might be like this: back pain, you might have anemia or low blood count, you might have a kidney injury or low water work. And the last is the hypercalcemia, feeling thirsty or increased water work. Initially, it will be increased. Then later on, the kidney will be affected and the water work will be reduced. Okay.
Oh, thank you very much.
Okay. Well done, Dr. Hosni.
Thank you very much. Thank you.
Most welcome. You prepared the scenario. You have another scenario. Okay. Dr. Dina asks, should we mention chemotherapy side effect in general? If he asks you, you can go through it. I don't think the time will help you to even to enumerate the possible side effect of chemotherapy. But be sure, Dr. Dina, any scenario you need to talk about chemotherapy, the patient will ask you these questions. So be ready to address this point with one or two maximum or the most common side effects. But if you go through the all side effect of chemotherapy, you might forget or you might miss other important things in the like in this scenario, the support or other concerns. So generally, chemotherapy, yes, it has its own side effects as any medication, and they are more prone to have more side effect because they are very strong medication that kills the cells, the cancer cells. I'm so sorry to say that. We can arrange another meeting to talk about the chemotherapy and the possible side effect in another meeting. But it can come as a separate scenario. Chemotherapy for multiple myeloma. Talk about the chemotherapy, the Hickman line insertion, the possible side effect, the hair fall. They will ask about it. The even infertility. They will ask about it. So be ready. There is another scenario for chemotherapy. Clear, Dr. Dina?
Yes,
Okay.
doctor. Thank you.
Okay, most welcome. Dr. Hosni, did you prepare? Yes, good.
Yes.
Consent. I don't think also in this scenario because you are going to break bad news. You have here two tasks. Let's talk about the task in this scenario. Breaking bad news and counsel for disease, right? You are counseling about multiple myeloma. And they didn't mention chemotherapy as task here. So you don't have or you don't need to talk about the consent. Whenever they mention talk about chemotherapy, here the time to talk about a consent related to the chemotherapy. Okay, I'm talking about management plan. Okay, let's talk about clinical point of view. The one who wrote chemo in general, yes, doctor. In chemo in general, if they ask you as a task, talk about chemotherapy, you have to get a consent. Let's talk about clinical point of view. What are the other possible management plan in multiple myeloma away from the chemotherapy and when to mention it? It's very important point. I focus on the age here. It was 63, right? What other option for chemotherapy for multiple myeloma as management? Who, anyone knows?
Transplant.
Transplantation.
Perfect. Stem cell transplant. When to talk about it, Dr. Hosni, as this is your case. This is part two, right? Part two question. When to talk about stem cell transplant? Does
After
this patient fit?
I'm not sure, but if chemotherapy has failed to give a good result,
No, there is another indication.
Age of the patient.
Perfect. It's the age of the patient. How old? You can start or you can think about the stem cell transplant.
Less than 40,
Less than 50.
50 years.
Yeah, less than 50. This is the time to talk about stem cell transplant, which is not our case today. But it might be one of the options. You can talk about it if you have patient less than 50. These are the points or the parts of clinical judgment. Okay. So whenever they want to judge on your skill or skills, whenever you talk about stem cell transplant, this is clinical judgment. If you talk about chemotherapy, this is one of the clinical judgment because you speak about the management plan, the suitable management plan, not only management plan, suitable management plan. So don't talk about stem cell transplant in this scenario. It will be considered as wrong. Okay, wrong judgment. They can minus you in this if you mention it. A good thing here, Dr. Hosni didn't mention it. Maybe no time for it, but be sure that whenever you have patient less than 50, he has multiple myeloma confirmed, you can speak about stem cell transplant in a brief, not in details, but you can talk about it. Okay. Dr. Hosni, we are waiting for your scenario. Do you find any
this scenario?
Scenario to offer Dr. Henry? I asked you to prepare a scenario for Dr. Henry. Did you?
No, I didn't prepare. So I will search الرخد.
Any scenario, yes. Any scenario you heard recently or before you practice or you shared it with any friend. Any scenario. No
So
particular scenario. Anything, yes.
I will search for a scenario like
Okay, try to find it quickly any scenario.
for في chromocytoma.
Okay, it's okay. You have it or you can share it.
I will search and when I will share it when I find it.
Okay. We're waiting for you.
Okay, thank you very much.
Anyone want to comment or to ask any question? Yes, Dr. Ahad, you can comment.
So when it's just a small comment and very like maybe unobserved, but I think that will make a difference in delivering the information to the patient. So when he mentioned that the result is with me and is not as we hope, and then he just mentioned to the patient that you have condition known as multiple myeloma. Have you ever heard about this? And the patient is being prepared for the information or for the news itself. So I think it's better delivering it in such a way that the result is with me and is not as we hope, and then give a golden like pose, and then mention to the patient that you've been having type of blood cancer called multiple myeloma. I think it's just a matter of ordering the thing, but when you've been closer to the river, just jump and don't make like another pose for the patient to be to have more time and being separated from like preparing to the bad news. So I think that could make like little difference, but it's much in a better way in delivering the breaking bad news. And it's not applied to this case specifically, but I mean in general, when you just prepare the patient that we having a news that you are not is not as we hope, and then you're just like telling the patient that you have a condition called as blah blah blah, and then have you heard about this condition? Has been the patient has been prepared from the beginning. So I think better delivering in such a way that unfortunately you have a type of blood cancer called multiple myeloma, and then you can like explain the condition more.
Perfect, Dr. Ahad. I agree with you. Totally agree. This is what I mentioned also. I said after when I instruct to Dr. Hosni to do so, I said you have to say you have a cancer, type of cancer in the blood called multiple myeloma. So what you said is the perfect way. Not to say multiple myeloma, then ask her, do you know about it? Because never ever someone will know about multiple myeloma. So it's difficult to handle it in this way. Yeah, it's accepted, but we are talking about the optimum. Yeah, the optimum is to say it's a cancer in your blood. We call it in medicine multiple myeloma. Now you can ask, have you ever heard about it? He will
Yeah, and
tell.
I think it's not
Yes.
the usual way that we are delivering
Yeah,
the diagnosis. So the usual way that you should
yeah,
tell
exactly.
the patient about the diagnosis, even if it's something uncommon. So you can just tell the patient about your probable diagnosis, even if it's not it's uncommon. But in this way, you just like prepare the patient for the bad news, and we are having the result now is not as we hope, and then the patient is being fully prepared, and then you just like separate the patient from the bad news that we have condition known as have you heard about it, and the patient is not being distracted about like receiving bad news. So I think that should be the better way of any delivering bad news, just to start with the bad news itself, was it's cancer or anything like bad, and then you can just define it.
Yeah,
And
totally
also,
agree.
Dr. Bazim, sorry, I wanted to just add something too. Like also what not she as what the candidate said that is not as we hope. Sometimes I think when I was preparing for my first exam, one of my I think in the one of the online classes I attended, they said that the term not as we hope, sometimes some examiner frowned at it because since it's the bad news, you've not discussed with the patient prior to this time to hope for certain things. So probably it's better for the candidate to say it's not a good news, rather than what the candidate said that is not as we hope, because you are just meeting the candidate, the patient or the surrogate, telling him that is not as we hope. The you've not had any expectation on the result. So in some examiner may tends to frown at that concept, not as we hope. Instead, probably some will prefer the word, not a good news, than not as we hope, like what the candidate said, And also that second golden silence or pause was not, given to me. I just remember that. So he just said it and then asked me if I've heard about it before. You should have said it and then pause and allow me to, to think about it, or probably, mourn for a while before telling me, start telling me if I've heard about it before. And that's where I looked at it. I don't know if I'm wrong anyway.
Yes, Dr. Henry, any way you can mention it, or you can just pay attention to the patient. It's not good as we hope. It's not as we hope. It's not good as we expect. It's not so. The way you are delivering, they just to pay attention to the patient that he has something alarming, something concerning. It means that there is something not good. You got it. So it's not. It doesn't matter how you are saying it. Almost the same, but just to pay attention of the patient that he has something alarming. Okay, in order to save the time, Dr. Henry, your scenario, counseling for chronic kidney disease, adult polycystic kidney disease. Mrs. Noha, 25 years old, has been complaining of recurrent flank pain and bloody urine, kidney function done for her and was normal. Ultrasound abdomen done for her and diagnosis of adult polycystic kidney disease is confirmed. You are the senior house officer of the outpatient nephrology clinic today. You have been asked to discuss the result with her. It's simple scenario, straightforward. Just prepare yourself in 1 minute. If it's okay with you. If not, we can add one more in a minute. So 2 minutes, if you wish. Just let me know if you're ready.
Okay. Well, just give me 1 minute. Let me just look at it again. Okay.
Okay.
Okay, perfect. Here you go.
Hello.
No.
I'm Dr. Henry, one of the doctors here. May I confirm you are Mrs. Noha, 25 years old?
Yes, right. I'm now 25 years old.
Pleased to meet you today.
Nice to meet you, doctor.
I'll be discussing concerning your health condition. I don't know if you're okay or you want some of your loved ones or friends to be with you. I will discuss.
No, doctor, no need.
Okay, all right, thank you very much. If you don't mind, just to ensure that we're on the same page, can you please tell me what you know concerning your condition?
Doctor, I'm afraid I have serious kidney disease, as my father has kidney problem, and he died. I am afraid.
I'm so sorry to hear about that. My condolences, please. That must be really difficult for you.
Yes, thank you, doctor.
Okay. How are you feeling now?
Good, doctor. I want to know what is my condition, and am I going to have the same problem like my father?
Okay, I must appreciate your willingness to know concerning your health. Just to have anybody told you about any investigation you've done or concerning your case so far?
No, doctor.
But I've discussed it. Okay. Are you aware that you've done some tests with us?
What is the doctor?
Are you aware that you did any particular tests, blood test and picture tests?
A blood test was done, and imaging. Today I am coming to know what is result of my blood test and imaging.
Okay. So before I discuss the result with you, how you feel? How is your pain going? I understood that you're having pain that has been going on and off in your flank. How are you feeling now? Are you okay? Are you
Now
better
I'm
now?
okay, but sometimes I have this pain. But now I'm okay.
All right, good to know. Good to know. Actually, we've done the results of your test are out, and the urine test came out normal. Also, the kidney function test that we did is also from your blood also came out to be normal. However, with the image, or the picture test we did for your tummy shows that you have show that there was some problem we noticed. Actually, we found that we have some multiple shadows within your kidneys. Have you been told about that before?
No, doctor. So is it a serious condition? Can you explain more?
Okay. Actually, the following the image, the picture test we did shows that we have a particular condition called adult polycystic kidney disease. Have you heard about that before?
No, doctor. I don't. I don't have enough information about it.
Okay, I think. Do you want me to tell you more about it? Do you mind if I tell you more about it, about the condition?
Sorry.
Do you mind if I tell you if I tell you more about the condition?
Yes. You
Okay.
can. I came to know from you.
Okay. Like the word, it's a condition that is a genetic condition that can be getting from one generation to another. Like you said that your father had a kidney problem. It's possible that he may have similar condition, or probably somebody from your family. This condition tends to affect the kidneys, and it forms cysts. Forms some pockets of collections within the kidneys, and also it can also affect the liver and some other organs. Those collections can be found. Those pockets can be found in some other organs, like the liver, sometimes the spleen, sometimes the pancreas. And in your own case, since your blood is normal, your blood test is normal, your kidney function is normal, which test will tell us that it is just starting. It has not become complicated. However, it is good to know how it presents. Do you understand? I don't know if are you clear concerning what I just said so far? Is it clear?
Yes, doctor, it's clear. But I am worried about. May I? Is it a serious? May this condition serious? May I die?
Yeah, I quite appreciate your efforts to your concern. Typically, it is like it is now. It is a serious condition, but in your own case, we've seen it early. That is also a good thing because we're able to plan towards it and ensure that you don't develop complication. Like it can present with a high blood pressure. It can come with you having urinating some blood, and in some conditions if it becomes so severe, it can cause bleeding towards into the brain, and sometimes affect other like pain within your flank. But good enough, you detect it early. We can able to plan towards you, and then refer you to a kidney doctor that will follow you up and then ensure that you get the good care that you require. I don't know if that's okay.
Okay, doctor. So I would like to know, is this condition will be transmitted to my kids in the future, and how can I prevent it?
Yeah, it's a good question you've asked. I'm sorry to tell you that actually it can be transmitted to your next generation or probably to your future children, in the sense that as it is now, it has it's a genetic disease that can be transferred to them. However, each of your if each of your children have 1 in 50% chance that if your spouse doesn't have it, has 50% chance of coming down with similar condition. I'm sorry to tell you about that. Do you have another concern?
So it is not preventable. It is not a preventable condition. How can we prevent it? And
2 minutes left.
I'm so sorry to tell you that's a good question you've asked also. I'm so sorry to tell you that this condition it can be prevented. It cannot be prevented. But however, for your own case, for your future children, once you are ready to, I don't know if I'm asked, are you married or are you in a relation? Are you currently married? If you don't mind.
yes, I'm married.
Okay. If you have you had any children?
No children yet.
Okay, once you are ready to have children, you may refer to the maternity doctor alongside the specialist in this field. They're able to plan your pregnancy and do some certain genetic testing, within and then prevent you from transmitting it to your future children. I don't know if that's okay.
Okay, doctor.
Any other concern?
Also, I'm concerned how can I prevent deterioration of my condition?
That's a good question also. Like I said, at this point, we refer to a kidney doctor, which will place you on certain medication that will prevent you from having worsening of the kidney, of the function of your condition, and then monitor you with serial blood tests and imaging tests. Subsequently, they can be able to follow you up by, there are certain medications that also help to prevent you to prevent progression of the condition. I don't know if that's okay.
Okay, thank you, doctor. Thank you very much.
Any other concern?
Thank you very much, doctor. Appreciate it.
Just to summarize, can you please just summarize what we just discussed so far, just to ensure that we are on the same page? Can you summarize what we've said so far? Can you just tell me? Yeah.
What I get from you, this condition is liable to not to be deteriorated more by good follow-up with doctor of kidney doctor to avoid complications which might happen. And for the future generation, we had to follow with women doctor and doctor of genetic doctor.
Yeah.
To avoid this happening to my kids in the future.
All right. Thank you very much. If I may ask, are you on any contraception?
Now there is contraception.
Are you on any contraception, or you are pregnant currently?
No, now in contraception.
Okay.
Because you're on contraception.
Yes.
Okay. Which of the contraception? Okay. Which of the contraception device are you using? Is it
pills.
which of the contraception pills? Okay.
Pills.
Oh, okay. Okay. I think
just to time is up, Dr. Henry.
Okay.
Yes, Dr. Hasni, you can comment quickly what he covered and what he missed quickly.
I think she's covered my concern. She has replied to my concern, and she was empathetic. I think she did well in all.
You mean he, Dr. Henry, he.
Dr. Henry, yes. Sorry.
Okay. Anything else you want to add?
No, thank you very much, doctor.
Okay. So my comment to Dr. Henry, why you spend this all long time to explain about the condition? You mentioned the genetic maybe at the minute 6, right? And the disease name, autosomal dominant or adult polycystic kidney. It was too late, right, Dr. Henry?
Yeah.
Yeah. What the difficulty to deliver it since earlier?
I just wanted to break it in piece for him, so as to know, I don't want to overburden him with
Okay.
information,
So what
basically.
about the pathophysiology? We are usually talking about four parts in the counseling about disease. First of all, the name, of course. Here you can consider breaking bad news. What do you think?
Mm, since it's not, it's other, the kidney function test is normal, the blood urine is normal,
Yeah, so
and it's
yeah, you can deliver as only news because you don't know. Is it?
okay.
And there is also possibility to live with this cyst. 50 or maybe half of the percent of the people they can live with this cyst, right? You
Yeah.
don't know what are the condition. Since the creatinine in here is good, you can consider here is okay. So what you want to talk about here, the lifestyle modification to control and not to have increase or progress of this cyst, right?
Yeah.
By giving some medications, controlling blood pressure. So you have to deliver this information early. You have a condition called adult polycystic kidney disease. Do you hear about it? Yes, I know my father was. I'm so sorry for your loss, as you said. My condolences to you and your family. There is possibility to be honest with you. There is possibility to end up with dialysis. However, we will do our best to avoid this step in your life. How, doctor? You can control your blood pressure. You can take some medication to regress the size of the kidney. We will have another meeting to talk about it. What is the pathophysiology? It's running in family in 50%, right? And since you have this cyst, it means that you have the gene of this disease. What are the complicated, the manifestation? As you said, some tummy pain, back pain, blood in urine. Even you have to avoid any sports because this cyst might be ruptured because of trauma. Avoid any trauma, please, and not to be doing any or take care while doing your hobbies. The other complication, blood stones. So we will follow up you with the kidney doctor in order not to have this complication. Next, the management plan. How you manage lifestyle modification, control blood pressure, medication to regress the size of the kidney or of the cyst. Then the marriage. Are you married? Yes. Any plan to be pregnant? Don't ask about any contraceptive pills. Okay. Any plan to be married? Sorry, to have a pregnancy? Yes, doctor. I want to be, or I am planning to have. Okay. Before doing so. Sorry. Okay. Before doing so, let us refer you to the woman doctor, along with the genetic counseling team. Why, doctor? It's important to have safe baby with safe gene because if you don't have the arrangement, you might have this disease running to your kids in another 50%. So every kid might have this disease in 50%. What else, doctor, you want to do? What's your job? So smoking alcohol. And here in this scenario, please, any of your offspring, your brother or your siblings, please, if offspring the kids or your siblings, the cousin, let them arrange with a kidney doctor to check for them. Okay, is it possible? Yes, most of these either siblings or offspring they might have this, and they have to be doing screening. They should do in non-invasive first the ultrasound to check if there is any cyst, and if it is negative and there is high possibility you can even do the genetic counseling if they are joining a job, sensitive job like pilot or doing military or sportsman or sportswoman, whatever, or if they have planned for pregnancy and they want to conceive. These are the indication to do screening first by non-invasive ultrasound. If negative, you can even do the genetic counseling in three conditions. If they are joining sensitive job like military, or they are doing sports with contact, or they are planning to have a baby or to conceive. These are the indication to do the screening for others. Okay, any kid or any child more than 16, he can decide to do this test or no. Usually we are doing it above 20, but the 16 for decision. This is in summary how to do this scenario. I think you went late, that's why you didn't have the time to screen others, right,
Yes.
Dr. Henry? Yeah. So
Yeah.
it's a very hidden, very important hidden point. You have to discuss it.
That's true. That's true.
You have any question, Dr.
Yeah.
Henry?
Thank you very
No,
much.
thank you very much. Thank you very much. I think what you said is true. Yeah. Thank you.
Okay. If she ask about the possibility of dialysis, there is possibility you can talk about the possible way of dialysis. But if she ask, but don't let her be suppressed or depressed because of this information. There is possibility to live without dialysis. Yes, there is, but for how long we don't know. Our aim now to have a safe life, and size of the cyst will not be increased. Helping this by doing some measurement and some medication. As I said, controlling the blood pressure is very important. Okay, how to control blood pressure? You can talk about low salt, restrict the diet, protein. Okay,
Yeah.
doing exercise, all this, but not heavy exercise. Okay, and you can talk also about the hobbies. Avoid sports and contact sports. Dr. Ahad, is cyst jargon? Because I have noticed Dr. Henry mentioned pockets. Yes, you can use pockets. Fill the kidney is filled with cyst, or you can say bags, or you can say buckets. So start with cyst because it's called polycystic kidney, but you have to explain what mean of the cyst. Sacks, bags, pockets, all of them are correct. But once you start mentioning cyst, explain it once, then continue without. Is genetic doctor jargon genetic? No, it's not. Genetic doctor is something well known there. Any other question?
Thank you, Dr. Basim.
Okay, thank you, Dr. Hasni and Dr. Hilary. Anyone has a comment before ending the session?
I just have one comment. It's
Oh, yes.
outside the case. It's a general question. Just asking about the benign overseas centers. So, is there any well-known benign centers overseas compared to others?
Yeah, there is. I can contact you. Which center is good to do?
Okay.
Yeah,
Thanks.
there is good and there is also toxic as well. What to avoid and what to can choose. I will update you in the WhatsApp. Just message me,
Okay.
Dr. Ahad, okay?
Yeah. Thank you.
Okay. Thank you, Dr. Ahad. Thank you, everyone. See you tomorrow, inshallah, with a short clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum.